If you excite the sensitizer with a laser, it fluoresces in the infrared range. You use a camera with an infrared filter, and you can see the sensitizer producing a light of its own. It looks like this. In the picture that we just looked at, that's what it looks like coming through the camera. Now, the value to that is that we can see whether there's still sensitizer in the body, but more importantly, we can see where it is. Understand, we cannot see deeply into the body with this, but we can see it, and we can see it quite clearly when it's near the surface. So, if you're looking at breast cancer, it usually goes to the lymph nodes. And then the surgeons start cutting that out. Then you wear a compression stocking for the rest of your life. And it still progresses because, don't forget this, surgery does not stop cancer. It spreads it. I know the surgeons will say they don't believe that, but if you ask them what's the definition of seeding, they'll get a shocked look on their face because they'll suddenly realize that you know the secret code word that they use to discuss the fact that when you cut into cancer, it spreads seeds throughout the body which grow in other places. If you look at this patient, you can see that under the right underarm, there's no appreciable localization of sensitizer. Under the left, it's whoa. Now, she'd had scans, CT scans, MRI scans, PET scans, and they said, well, there might be something in the lymphatic system. We can't tell for sure, but maybe we should just cut them out just to be safe. Well, again, that's not being safe. Also, it means that you spend the rest of your life wearing a compression stocking to combat the edema. Not a good look when you're going out for the evening. So what happens with this? Well, if you hit it with the laser, it kills it. It swells up for a few days. With this patient, she had scans for a year afterwards, and they always said, no, there's absolutely nothing in the lymph nodes. The little lumps that were there went away. Fantastic. Beats having surgery. This is something that they simply do not have a way to deal with conventional medicine. Chemotherapy doesn't get rid of what's in the lymphatic system, and neither does radiation, and surgery just spreads it. So if my wife or daughter had breast cancer, the first thing I would do is look at what's in the lymph nodes and get rid of that to prevent it from spreading throughout the body rapidly, then take care of the basic cancer to activate the immune system, and wait for our system to clean up the mess that's going on in the bones and the lungs and everywhere that it normally spreads to. Activating the immune system is the only way to completely control cancer, and that's the entire focus of our treatment. Immune system activation. In the next section, we'll go over some examples of how this has treated things that cannot be treated with conventional technology. For example, bone cancer. Well, ask an oncologist what can they do for bone cancer. They'll tell you they can radiate it, but it won't actually kill the cancer, but it'll slow it down a little bit, so you'll have a few months of less pain. And then they'll put you on morphine. Unfortunately, they won't tell you that the morphine increases the growth rate of cancer to at least 3 times normal, because most of them aren't aware of it. You can find out about this on the website. There's data on the website about morphine and cancer and what can be used instead.